My name is Callie Hunter. I'm Skills Lab Coordinator at North Central Missouri College, and I'll be demonstrating how to do a ventrogluteal IM injection today. So first thing that we want to do is to check our physician's order to verify that we do have a medicine to give IM into the muscle. So once we've gotten that order, next thing that I want to do is gather my supplies. So I do need an adequate size syringe to hold the medication that we'll be giving. And so we're going to be administering, this is a 3 milliliter syringe, so this will be fine. I do want to be sure that I've also got a safety needle in order to, once I've drawn up the medication, then I need to switch needles to my safety needle. And this is a 22 gauge 1.5 inch needle. I want to be sure to get the adequate gauge and length to be sure to give this deep within the muscle. So next thing that I want to do is to draw up the medication that I will be administering. Of course, I would have already checked my 6 rights of medication administration, but today I'm just simply going to show the proper way to give an IM injection. So first thing that I'm going to do is draw up the medication, and we are going to be giving MAH00017 today, so I'm going to draw up 1 ml of this medication. So I'm just going to draw back some air, approximately 1 ml. I'm going to alcohol swab my vial here. I'm going to go ahead and inject the air. I'm going to tip this upward and pull back my 1 ml, being sure that I'm getting the air bubbles and things out of my syringe. And I'm going to put that to 1 ml. Next, I'm going to withdraw my needle. I'm going to scoop that way to ensure that I don't accidentally stick myself with the needle. I'm going to now I'm going to switch needles to my safety device needle, and this also makes sure that I am using a needle that is not dullent, okay, by drawing up the medication. So next thing I'm going to do is just twist off this needle and switch to my safety device needle at this point. I'm going to go ahead and dispose of this needle in my sharps container. I'm also going to need an alcohol swab for when I get to my patient, and a Band-Aid to apply over the injection site. So of course I would return this to pharmacy, and next thing that I'm going to do is enter my patient's room. So knock knock. Hi Mr. Jones, my name's Callie. I'm going to be your nurse today, and the doctor has ordered us to give you an antibiotic injection today for your infection. So I'm just going to wash my hands real quick, okay? And can you go ahead and tell me your name and date of birth? Okay, and that is correct with his wristband. Next thing that I'm going to do is I'm going to go ahead and position him onto his left side. That way I can administer the medication with my dominant hand. So I'm just going to go ahead and turn him onto his left side. Next thing I'm going to do is go ahead and apply gloves. And I kind of want him to flex that left leg up just a little bit. Or actually it would be his right leg, excuse me, up just a little bit. Okay, and I'm going to find my landmarks. I want to put the base of my palm at the greater trochanter, which is kind of where your bone sticks out of your leg, the top of your femur there. And I'm going to put the base of my palm there. I want my thumb to be pointing towards the groin area. I want to find the anterior superior iliac spine. So here's the part of your hip that kind of sticks out. The crest would come across this direction, so the spine would be about right here. And I want to point my index finger towards that direction, and I want to move my other 3 fingers dorsally towards the buttocks. So next I want to go ahead and alcohol swab from inner to outer. Okay, and then I'm going to use that alcohol swab to mark my insertion site. So next I'm going to go ahead and remove the cap on my needle. Okay, and I'm going to tell Mr. Jones here that he's going to feel a little stick. I want to do the Z-track method, so I want to be sure to hold that skin with the base of my hand. I'm going to pull that skin to the side and hold that Z-track method. I'm going to tell Mr. Jones that he's going to feel a little stick. I'm holding the needle like I would a dart, so I'm going in right at 90 degrees. So Mr. Jones, you're going to feel a stick. 1, 2, 3. Okay, I'm still holding the Z-track method. I want to be sure to aspirate to ensure that I don't have any blood return. I'm going to go ahead and inject slowly, continuing to hold my Z-track. Okay, next I'm going to withdraw the needle. I'm going to safety lock. I'm going to release that Z-track at this point. You shouldn't have a lot of bleeding, but you may have just a little bit. I'm going to go ahead and apply a Band-Aid to the insertion site. Okay, so I'm just going to apply a Band-Aid there. Okay, I'm going to reposition my patient. I'm going to dispose of my used needle in my sharps container. I'm going to go ahead and remove my gloves. Whoops. I'm going to remove my gloves, ensure that he is comfortable, and that concludes the ventrogluteal IM injection.